There will be one new prostate cancer diagnosed for every 1,000 men every year on Guam, as well as one death a month as a result of the male-specific disease.
The risk factors obviously is age, because prostate cancer happens only in men who are 60 years and above, although there are some men who would be diagnosed at 40, 45 years old, and these are men with a strong family history of cancer, specifically prostate cancer. So it's age, it is the family history, and of course, you know, the risk with our lifestyle, like smoking and obesity, will also give us high risk of developing prostate cancer.
According to Dr. Patero, who studied urology in the Philippines and in the United States, prostate cancer is one of the most controversial of diseases. Specifically, there are conflicted studies as to how to screen and diagnose the disease using prostate-specific antigens, or PSAs.
If you have a high PSA, it means that there's something going on in the prostate. Now, whether this is a benign process going on or is this a malignant process going on, the PSA cannot really give you what is the cause for the elevation. The only way to detect prostate cancer is to do a biopsy in patients with elevated PSA, or when the rectal examination, which we do every year, annual rectal examination, is abnormal.
Dr. Patero says despite controversy surrounding PSAs, he still uses them as tools to help detect any activity occurring in the prostate. He also recommends rectal exams. Treating the disease also has its share of controversies, as there is no evidence to what's the best treatment, if treatment is necessary at all.
Not all prostate cancers should be treated. In fact, if you treat some of this prostate cancer, it is potentially doing more harm to the patient. So that is one very good study, very new, just off the oven, if you use the term.
Some studies even say certain vitamins increase one's risk of getting prostate cancer. For those managing advanced prostate cancer, there are medications on the market to help.
This is a very dynamic field. In the past 3 years, there are 5 new medications that were shown to give a better survival advantage in patients with advanced prostate cancer, and all these drugs are FDA approved already.
Ultimately, though, prostate cancer is indolent. That is, it doesn't kill you in a matter of days, months, or even years, but 13 to 15 years after being diagnosed.
Prostate cancer is a very prevalent disease, and most of it, if we catch it early, then it's a highly treatable disease. And even in those patients who have prostate cancer already, there is new evidence that treating it might be a bad idea. It might be even harmful.
Health Check is presented by
Island Cancer